Welcome everyone to the second episode of Decoding AI in Healthcare. I am Dr. Harshita Gupta, Community Engagement Manager at MedSynapse. Today, we are privileged to have two remarkable experts who are pioneering the fusion of healthcare and artificial intelligence. So first, let's welcome our esteemed speaker, Dr. Dipu Patel. Dr. Dipu is a digital health consultant. Currently, she serves as the Vice Chair for Innovation and a professor at the University of Pittsburgh DPAS program. Dr. Dipu's unique blend of clinical expertise and a deep understanding of technology role in enhancing patient education and advocacy drive her work. She believes that as technology and education continue to evolve, the human touch in healthcare remains irreplaceable. Today, she joins us to share her insights into the transformative power of AI in healthcare. And now it's a pleasure to once again introduce our distinguished speaker, Dr. Amit Dey, for this second episode. He has over a decade of experience in clinical practice with diabetology as his primary subspecialty. He's not only an expert in the field, but also an AI entrepreneur dedicated to transforming healthcare through innovation. In our previous episode, we learned about the basics of AI in healthcare, and today we will be taking one step ahead and discussing more about the granularities of AI in healthcare. So without any further ado, let's get this podcast rolling. And if you have any questions during the session, feel free to drop them in the comment section. And now I'll hand over the baton to Dr. Amit for their talk on decoding AI in healthcare, the past, present, and the future.
Thank you very much, Harshita. Warm welcome to everyone to the second episode of our podcast series of Decoding AI in Healthcare. And the last episode, we had discussed about the basic introduction to artificial intelligence. And today I have with me a dear friend, Dr. Dipu Patel, digital health consultant from the US. And Dipu and myself have been discussing artificial intelligence, and we have been trying to decode the basics of AI. And it's a privilege to have you with us, Dipu. And it's always wonderful to discuss the prospects of AI in healthcare with you. Welcome to the show.
Thank you so much, Amit, and thank you, Harshita, for that very kind welcome. I'm very excited to be here and hopefully share some of our collective knowledge with everyone.
Fantastic. So, Dipu, to start with, we would like to know about your role, in the community as a digital health consultant, and we've learned that you're working as a physician assistant with over, I think, 2 decades of experience. So, tell us about your work, back there, and how do you place yourself in the community, and what is the role of a physician assistant?
Yeah, thanks. As you mentioned, I've been a physician assistant PA for 23 years now. My clinical background is in emergency medicine, urgent care, and I dabbled in hematology oncology for a little bit before I switched over to academia. And so I teach full-time now at the University of Pittsburgh. The role of a PA is very interesting, and I think for those of our audience members who may not know what a PA is, it is a role that was born uniquely in the US to address partially some workforce shortages, but also to help physicians really meet the numbers of patients that they were seeing. It was formed out of the US Navy, actually, Navy corpsmen who were returning from the war and had this medic training, but the skills were not translatable to quote unquote civilian practice. And so the profession of a PA was born to help kind of physicians and collaborate with physicians to see patients so that we can work collectively together for improved patient outcomes. So the PA profession in the US is about 50 years old now. I like to say we're past our teenage years, we're actually really growing by leaps and bounds. In the US, there's over 130,000 PAs practicing in all sorts of specialties, from emergency medicine to the surgical specialties to primary care to hematology oncology. So you name it, we're kind of practicing there. And in the last 2 decades or so, we've seen an increase of PAs actually taking a foothold on a global stage. There are several programs that have started in the UK, in several African countries. I believe Ghana, Nigeria, South Africa all have PA programs, as does India. India has a couple of PA programs, to my knowledge at least, focused mostly in the cardiothoracic area in terms of practice, a surgical practice. So while the scope varies from country to country, what is consistent and maintains a high bar for all PAs is the patient outcomes and the quality of care that we continue to deliver, and that we are highly skilled at what we do. In the US, it's a master's degree program. So you get your bachelor's and then two more years of schooling to get your PA degree. We are board certified. We have to take our boards every 10 years, just like the physician colleagues do here. And I think in the Indian subcontinent, I think it would be the equivalent of an MBBS. I think that's probably the closest I can give in terms of an analogy. I think what I really want to mention to people is that we are very skilled at making sure that we take care of the patient holistically, and that we partner with our physician colleagues when and if there's a need for us to collaborate. We are essential to many teams in this day, and I think, Amit, you know this, there's not enough of us in the healthcare workforce to see the patients.
Yes,
just physicians, right? So we all need the help we can get, and there's plenty of work to be done for everybody.
Absolutely. And I think, we are talking about on a something similar context about the division of the responsibility of the healthcare workforce. And it's fascinating to learn from you about the role and the job responsibilities of a PA in the US. And I think, yes, as you said, that it has got different names in other parts of the world, but I think we all have got those divisions of responsibilities in our, medical systems or the clinical practice systems. That brings me to an idea that, when we talk about artificial intelligence, we are somewhere going to place artificial intelligence with a responsibility in the, that ladder of giving healthcare to the patients. So let's talk about AI. Let's now delve deep into the topic of AI. And today, friends, we're going to talk about a little about the past of AI. We're going to look at how AI has evolved, a look into the history, and we'll try to see where we stand with artificial intelligence today. And then Dipu has got some fantastic visions and viewpoints how we can see AI impact the future, and we would love to hear that from her. So to start with, Dipu, give us your overview about how did AI come into existence, and we all know it's something that is not new. I mean, it's there since 1957, and Alan Turing was the person who coined the term, and there has been a lot of work in artificial intelligence going on in the background. But give us an overview how this all came into being, and then the sudden hype of AI coming into all of our, the practice and into our existence. Give us an overview of what it be.
Yeah, so I'm not going to give you a history lesson because I think a lot of people might get bored, but I agree with you. I think in the background, AI has been doing a lot of things for us, especially within healthcare. And I think one of the insights that we have recently gained, and I would say it's one of the positive things that came out of this global pandemic, is that it put AI, digital health, at the forefront of our practice. Like whether you wanted to do it or not, it was here and in your face, and it was here for you to harness. And I think while we're all kind of grappling with it, the foundation has been laid from other industries, right? So Alan Turing, as you said, started it in the 50s, and we've kind of seen it evolve in other areas outside of healthcare, manufacturing. We've seen it in aerospace engineering. We've seen it in other areas. And I think although adoption had been slow, we have made in healthcare incremental progress towards really defining and grappling with the issues around healthcare. I think at the end of the day, our outcomes, because there's a human being attached to the end of it, it makes it a little bit more risky. And we as healthcare providers tend to be a little risk averse naturally by our training, right? And so from a kind of not necessarily US centric perspective, in '89, there was an International Medical Informatics Association that was set up. If you fast forward into the 90s, you had the ATA, which is the American Telemedics Association, which was one of the first associations out there to really advocate for and create platforms to have robust discussions about telemedicine. We know telemedicine now because we were thrown into the midst of it, but they had been talking about the policies around this for a really long time. And I think the 2000s were an inflection point for all of us as a culture. I think part of this is, I believe Dr. Bertlin Mesko actually says
Yes.
that it's not only about us as clinicians and a healthcare change, but it's a cultural change. And one of those inflection points, I think, in the 2000s was the Fitbit. It really revolutionized the ability to bring to your home these smartwatches and devices that are now wearable, approachable, affordable to a degree, and really provide you with some data that you can make personalized lifestyle and fitness decisions. And as we progressed into the 2000s, around 2017, 2018, the FDA actually launched its first digital health unit. So FDA is the Federal Drug and Food Administration, Food and Drug Administration, excuse me, in the US, that kind of authorizes the use of all of these devices for the general market. And then that very quickly has gone into policies being adopted. The AMA adopted its AI policy in 2018. In 2020, the FDA approved its first AI-guided ultrasound device, and so on and so forth. I think since then, it's just that trajectory, which was a nice, gentle slope over the last few decades, has just gone up.
Yes.
Very, very.
So I think there was also this cold period, I think from the 2010 onwards, wherein not much was happening. And I remember, even in the 2015, 2016, we were fringely working on creating pattern recognition algorithms that would just help you screen certain predictable diseases, like we were using it in the screening of retinopathy. I mean, in radiology, there was quite a lot of advancements happening because you could feed, with a set of images as an input, and you could have a supervised learning, machine learning model giving out a certain output coming in. I think the whole buzz got created with the development and the introduction of generative AI. Because then the possibility, in the field of medicine, the possibility of predictability and clinical decision support tools, I think that became a huge sort of an entry where it made us all think that, are we going to kind of think about medicine and the way we look at patients' ailments the same way we did a decade back? And I think that brings us to this kind of discussions where we are all trying to absorb this in, and we are all trying to sort of understand that, is things going to change? Is our perspective going to change? Is our way of practice going to change? Are we going to get replaced? Is $1 million question that most of us keep asking to ourselves. So, Dipu, tell us about it. I'm sure that you're working with, and you've got interactions with a lot of people, mostly back there in the US, who are working on fantastic tools which are going to be used in clinical practice. And I think some of them are also in the research levels, and some fantastic tools are already out. And I think we have experienced using some of them. Tell us your ideas about this and your experience into the present, the AI tools which are there for healthcare, and how it's really helping shape up the use of AI in our fraternity.
Yeah. So the short answer of, are we all going to be replaced, is no. I think it's a resounding no at this point. Generative AI has certainly been a game changer and a force multiplier for us in healthcare. But from my point of view as as a PA, as an educator, as someone whose role is to think kind of forward 10 years into the future, I think we are going to have to use AI and in our practice. I think it will certainly enhance a lot of our skills, and I think it'll be a must-have skill for those, especially graduating in the next 5 to 10 years. Medicine and healthcare in general are very slow to adapt and adopt changes, especially when it comes to education. It's definitely a very slow-moving ship, right? But I think this is going to change it, because I sit here and I talk to my kids, and my kids are learning this stuff in 7th, 8th, 9th, 10th grade. They are being exposed to it. And so as an educator, I need to be prepared to have these students sitting in my classroom and have at least an equal amount of knowledge, if not more, than them, so that I have the ability to teach them about what's next, right? And I'm not talking just healthcare, I'm talking every field is going to be impacted by this. So I think, and on the flip side of that coin, as important as this technology is for us to use, it is going to make that human touch even more important. The teaching of the quote unquote soft skills, right? Empathy and sympathy and the human touch, those feelings and emotions that go with actually caring for a patient, are actually going to need to be taught at a higher skill set than they have been in the past, and really being able to get to the core of the humanity of the patient rather than just the lab test that we'll be interpreting. So I think there's a lot of areas for growth. And are we going to be replaced? No. I have to put an asterisk by this and say not yet. All right, because I don't know what the future will hold. And I think part of it also is going to be decided by we as humanity, as healthcare providers, and how well we're going to adopt this technology and how we're going to utilize it. Because that gets to the core of the ethical concerns that we all have as healthcare providers, which we are actively grappling with as a profession.
Yes, I think two very important points you really made there is, that one is that every individual in the field of healthcare, whether a doctor, whether a physician assistant, a nurse, a paramedic, needs to learn how to leverage the use of artificial intelligence into their work and into their practice. And I think we were discussing this in the last episode as well, that a segment of our work is always going to be repetitive. And that repetitive segment of our work can be effortlessly done using the AI tools, which has evolved and which are going to evolve in the next 3 to 5 years. So yes, the next 3 to 5 years are going to be very, very important in this paradigm shift that is coming in the segment of healthcare. And it's going to bring a lot of challenge on us to adapt to it, and more importantly, to leverage the use of this particular technology into our practice. I completely agree with that fact that you said that no, we are not going to be replaced. But you look at yourself as a physician assistant, as a doctor, and what are your thoughts of virtual health assistants coming forward? Ethical context being put aside, I mean, that's one segment that we're going to have to talk in details about. Maybe we'll need a full episode on discussing the ethical. Yeah, that's going to be a whole lot to talk about. But how do you see the virtual health assistants going hand in hand with a physician assistant, with a nurse, with a paramedic, healthcare worker, or even with a physician in the days to come?
I think from my point of view, it's a welcome addition to the team, because I can't hold everything in my head, nor can you, in terms of patient information. So having a virtual assistant say, I'm going to read all of these thousands of pages of medical records for you, summarize it for you so that you can then make the best informed decision for a patient in this moment, right? Because it's not possible for us to read 100 pages when you have 20 minutes to see a patient and care for them and manage their chronic diabetes, because it's just physically not possible, right, from a time perspective. And so I welcome this expansion to the team, and I think it's going to be a new skill set that we are going to have to learn. we can also talk about, and maybe this is for a future conversation, the new jobs that are going to be created within healthcare, right? Just like PA was formed out of a need in that moment to care for patients, there are going to be new jobs that are created. As I said at the top earlier, there isn't, we have so much work that needs to be done. We don't have enough bodies to do it, but maybe we can have a virtual assistant do it for us, right? And as you said, a lot of the tasks that we do are not actually in the engagement of patient care. They're those repetitive tasks of documentation, taking a history, although I think there is a marriage that needs to happen between human history taking and a bot taking a history, because there are nuances there. But I think that collaboration really does need to be enforced and enhanced, and I think it'll make patient care better. I welcome it. I welcome data scientists on our teams as we expand this, because there's no way I can learn everything there is to know about that individualized patient. I was teaching a class earlier this week, or last week, excuse me, and I was telling the students who are their first year PA students, they've just started their course, and I said, you are very lucky because you are about to be part of a part of the cyclical revolution and evolution of how healthcare is being delivered. Back in the day, the doctors used to go to the patients' homes to see them, right? You didn't go to a doctor. As health and healthcare evolved and policy evolved, patients then went to the doctor, right? Or to the hospital or to the clinic. We are now seeing that transition back, right? Through the use of a screen, through telemedicine. And so now the patients are not going to go to a clinic, generally speaking, for their routine care. You, as the provider, are going to see them through their TVs and their computers and their laptops and their iPhones. So that evolution that's happening is an exciting time to be practicing, but it also is important that we learn and we prepare our students to be able to practice in that environment, because the skill set is very different, right? When you can physically touch a patient and talk to them versus the screen. It's not that the quality of care is any less, it's that the engagement is different, and it requires a different skill set that we need to learn how to teach and harness for our students.
Yes, and again, a very important point, what this is going to do, and this is a very strong opinion that I feel, is that it's really going to help us spend more time with each patient and commit more time for each patient. And I think that's going to be very important. And again, that would really bring another factor called empathy into our clinical practice. I was reading an article that can AI empathize as good as a human. I mean, that is another aspect to debate on, but definitely the use of AI and virtual health assistants into our practice, and just like what Dipu said, where we can leverage the use of AI to do the repetitive tasks, the logistic work, it will definitely help us reduce the physician burnout. And down the line, it would really help us empathize better with our patient. Maybe it will help us connect better with our patients, find out the missing links, something that we used to miss while we are busy looking at the screens and documenting. I mean, I remember in the earlier days of my practice, we used to write down the history and the medical notes like this. We used to look down and put it on the paper. And now when the patient walks into my clinic, it's like I'm kind of fixed at my computer. The patient is blabbing. So I was just thinking the other day that, generative AI is there. And we know that there are some fantastic scribing tools which are coming in. The patient can just narrate the history, and it all gets into your system in the form of a speech to text conversion using a generative AI foundation model. So that would be something fascinating to have into our clinical practice. I mean, it would just.
I envision that not too far in the future, we are going to have exam rooms that are completely equipped to wirelessly with AI to really capture everything we're saying and doing, and we won't have to write a note. We'll just have to review the note that.
Yes, AI. I think that's I think the very near future. I think we're going to get this, and that's going to cut down on a lot of our time on our practicing skills, right? And it's going to kind of improve quality time that we are giving to our patients.
Absolutely.
What are your thoughts? Yes. What are your thoughts, Dipu, on these clinical support tools and these predictive analysis? I think these predictive analysis are going to come in a big way. The other day we were discussing about various screening tools and how it has to merge with the epidemiology of that particular area and that particular country. So how do you think this is going to impact the ecosystem of healthcare? I mean, will it create a separate AI ecosystem? How do you see that impact?
I actually think it'll create a more cohesive global ecosystem, to be honest. There's nothing better than crowdsourcing global healthcare information so that everyone can have access to it and every provider can use those tools to make decisions for their particular zip code or area code, right? So imagine, we did this a little bit during COVID. I forget what country did it. I want to say it was either Singapore, Taiwan, or one of the European countries where they crowdsourced COVID testing information and were able to predict an outbreak in a particular area based on testing patterns, right? And so it's not that hard to imagine that we could do the same for cancer rates and diabetes rates and see what impact that has on decisions that you can make on a day-to-day basis for the patients that you see, but also then use the environmental factors in that particular area or zip code to make decisions about, oh, this patient lives here. They don't have access to a park nearby where they can go for a walk to improve their improve their lifestyle or weight loss or whatever it may be. Perhaps we can suggest other areas where they can go for a walk. So I think part of that is also really knowing the patient, and that is the first step, at least in a primary care setting or in a chronic disease management setting, to really start individualizing and personalizing care. I mean, that has been the gold standard for all of us, right? When I went to school, it's like every patient is different. They all have their own story. Although you have parameters, you have to tweak the medications and the recommendations that you make individualized to the patient. That's what we want, right? The thing is, we don't always have all the data to make that decision for that particular patient. And I think as we get better at predictive analytics with more data coming in, I think the problem is we don't have enough data sets to build and study upon right now, but I think we're working on that. And that, I think, is the next kind of iteration of what generative AI and ML and predictive analytics is going to do for us. There is a lot of movement, or has been at least, and I think you spoke to this earlier, in radiology, because we have images, right? We can train models on static images and it's predictable. But I think what's less predictable is the movement of humans and human nature. And that will take a little bit more time. And as we learn that, it's going to be really, really helpful and important. And I think probably in both of our lifetimes, we're going to see our doctors using predictive analytics and AI to make decisions about our care. Certainly in my children's lifetime, but I can imagine.
Yes, and very important point that is, again, I mean, you're talking about collecting an individualized set of data, personalized data from your wearables, and you're looking at interpreting that data and putting it into an algorithm, and then having a strong collaboration with a data scientist who can help you build the algorithm. So I think you're looking about a lot of collaborations coming forward. Because, you know, as some of us who have been exploring AI for the last few years, we realize this very strongly, that the output of your algorithm will depend upon a lot upon the input that you give and the quality of the data that you have. So that is very, very important. So what Dipu just said right now is something which I completely agree with, is that as doctors, we have to kind of evolve our way of collecting the data, interpreting that data, and then helping that data get converted into an algorithm, which is actually going to be kind of a reflection of your wisdom. I mean, what is artificial intelligence? We talk about AI as just a wiser self of you. So the algorithm that you are using, that you will be using in your practice, you want that to be your wiser self, kind of giving you a very personalized output. I think that's That's where every doctor has to come in, with their collaborations, perhaps with data scientists, with coders, with engineers. And I think we are really heading into that segment. So let's try to understand here. Let's get into some practical tips, Dipu. Here, you've been working on AI as a health consultant. You've been advocating the use of digital and telemedicine use in clinical practice. Where does a doctor start from? How do you start getting yourself into AI? Where do you start from? Where is the scratch you start from? What are your tips for our viewers?
So I will say first and foremost, there's two things: be adaptable and be curious. I think those two things will really help you truly understand this new ecosystem that is being sub-ecosystem, I guess, for lack of a better word, that's being built within healthcare. And I think both of us came to AI out of curiosity and really a willingness to say, okay, what can I learn from this industry that I didn't think had anything to do with healthcare, and now very quickly is shifting to having everything to do with healthcare.
Yes.
We are lucky enough to be on the cusp, on the very early upward curve of AI, and so I think being adaptable and curious about what area you want to practice in, what area, and how you think AI, predictive analytics, telemedicine, whatever it may be in this digital health ecosystem that you want to practice, be curious about it and connect with like-minded folks and get their advice. I think one of the nice and refreshing things about being in this community is that we're very collaborative and willingness to share, and there's a willingness to share our knowledge and information with each other. There really isn't this sense of silos that historically has plagued healthcare, both here at the US and on a global level. There's a warm community that wants to share this because there's, again, so much happening so fast that you really can't stay on top of it all without having a buddy in the community to say, hey, did you hear about this article, or did you hear about this? And every day there's something that's coming out that's like, oh, I didn't know about that. And so I would say adaptable, curious, create a community or be part of a community and really engage with them. And I think in terms of practicality, it does take some upfront cost and resource management for you to implement this. And I think, in the US, and you can speak to the India part, but in the US, a lot of the large hospital organizations are investing in infrastructure around these telemedicine platforms. And if you are a physician or a PA or a provider who's working at one of these large hospitals, get involved in the committees and subcommittees and ask the questions. Be curious about what are they implementing and how are they implementing it, because I think it's a great way to learn about what not only the foundation of these practices are, but then helps you build your own clinical practice. And you can be better informed as a healthcare provider. And I think in India, Amit, you were saying that there is so much information and there are platforms out there. Yeah, go ahead. Yeah.
Yes, I mean, one thing we've seen amongst the doctors in India, and I mean, I would say the general public in India, is that the adaptability is huge. You're talking about adaptability, and I'm very positive that our doctor fraternity is going to be very adaptive. There's one more point I want to bring in here. I mean, we all have been talking about best clinical practices, and best clinical practices comes out of looking at the evidence and practicing evidence-based medicine. And the other day we were discussing about using evidence-based artificial intelligence. I mean, imagine using the data points that you have, having the exact pinpoint interpretation of the data point, and then translating that using the evidences that you generate using the AI algorithm into predictive output for the patient. I mean, how better it can get in terms of accuracy. So I think it will kind of change the interface of medicine, because we all talk about evidence-based medicine. We follow the clinical trials, we follow the real-world evidences, we follow the prevalent guidelines and the protocols that is there. But we always find there is a gap in the evidence and in the practice. And I think AI is going to bridge this gap. This gap is going to be bridging, yes. And it's going to.
Sorry, go ahead.
Yeah, you please carry on.
Oh, I said I agree. I think it'll bridge the gap, but also not completely eliminate the gap, right? Because I think at the end of the day, AI and all of these large language models that generative AI is built on is trained on human entered data. So while we will narrow that gap, it's never going to go away, which is why I'm confident that humans are not going to be replaced by AI, especially in healthcare, because it's not something that can be closed completely.
I think the variability in medical science is always going to be there. Every individual is going to be different. Every input is going to have a variations of output coming in. So yes, while it narrows down the gap, I think there's always going to be needing a human interpretation of that. And that's where it's very important for us doctors and healthcare professionals to understand how these outputs are being created and how the algorithms are using these outputs.
Yes.
So
curiosity, right? You have to be curious about how this algorithm is being trained.
Yes.
While we're not quite there for the quote implementation piece of this evidence-based AI information, but there is active research going on. And so I would say in the next 5 years, we'll probably have a handful of AI ML guidelines that are going to be proposed for certain chronic conditions. I wouldn't be surprised. The only other thing that I would add to this discussion is that it is up to us as healthcare providers to push for healthcare policy to mimic what we want to see in practice. A lot of these things will not come to fruition if we don't match the policy, both from a public healthcare policy, but also from an insurance policy, which is very, I know not as much of a thing in other countries, but in the US, insurance policy drives a lot of these things in terms of adoption. So not as sexy sounding, but policy is equally as important in this.
It's a very important thing, policy and ethics in artificial intelligence. And I think this is something that's going to evolve as and more we explore the applications of artificial intelligence and the extent of those applications. So that's again a very important topic, and we're going to have to kind of keep them in different segments in our series. So if you look into the future, let's talk a little about the future. Sitting today, September 2023, what are the near future applications and utilities that you see coming right away into clinical practice, impacting the way we practice, let's say in the next couple of years, Dipu, using artificial intelligence?
I think AI is going to impact VR and AR and mixed R realities in terms of treatment of various diagnoses, and especially behavioral health disorders. I think it's going to change our clinical workflows from not only in an office setting, but also in terms of how we triage patients. I think it's also going to change cancer practice. I always find cancer care very, very interesting. Because I dabbled in oncology for a little bit, I was always amazed at how rapidly things changed in oncology because of genomic research. And really making that precision medicine really come to life for patients. And I think AI is definitely going to kind of put that field and subspecialty on steroids. So I think those areas, I think every area is going to be impacted, obviously, but in terms of clinical practice oncology, in terms of kind of workflows, it's going to be your clinical workflows and your office workflows. And then in terms of treatment, we're looking at pain disorders, behavioral health disorders, lifestyle management are going to be key. And I think the most research kind of going on across all industries in academia as well as in healthcare are the use of VR and AR devices that are going to really change how we use and approach the management of various diseases such as anxiety and depression and pain management. All of those things are going to really, really blossom into hopefully not using as many medications, but using these virtual reality worlds to really help us from a neurological perspective.
Wonderful inputs. And I think very true. In mental health, artificial intelligence does look very promising. And I think dwelling and getting into the subconscious mind is something that's still a mystery and a dark place. I mean, we are clinicians, but I think psychologists and psychiatrists would love to explore that. And let's see if artificial intelligence can get into that and kind of give us better insights.
There are some recent studies about, in terms of pain management, that are being looked
Yes.
at in sickle cell anemia when they're in pain crisis, and using VR to help with pain crisis without the use of opiates. So, again, that would be game changing for someone who's in a sickle cell
Absolutely.
crisis.
Promising days ahead of us. So that brings me to another thought. How do you see the next generation doctors and medical students evolving? I guess a lot's going to change in the next 10 years. And the ones who are studying medicine today are going to evolve and are going to come up with a lot of technicalities, understanding of AI. Even you're a professor, so you're kind of educating the next generation. So how do you see them evolving and coming up?
I think we are going to evolve to be more as partners with patient care, inpatient care, and even as a professor, as a student, it's a partnership rather than a mentorship slash, hierarchical kind of relationship. But when it comes to healthcare providers, I think because patients are going to have access to the equal amount of information that we as healthcare providers have access to, it's going to be a balancing or a democratizing of that relationship. And this is, again, something that Dr. Mesko has mentioned in terms of a cultural shift, right? That balancing of quote unquote powers. It's like, I'm telling you what to do versus, hey, I looked this up. What do you think about it? And so that goal that we've all had about truly having a trusted patient relationship I think will be a little bit closer to it through the use of these tools, because we'll be able to really communicate with patients about why this medication is not as good for you, but this one is better for you through the analytics that we will get. And I think the last time this kind of happened, although it did kind of, it's been a mixed bag, is when the internet happened, right? Everyone panicked when the internet first came on, and we were like, oh my God, like teachers panicked because they're like, we'll be out of a job. We won't have to teach anything. Well, it didn't quite work out that way, right? And healthcare providers panicked too because patients were coming to them.
Yes.
I saw this on the internet. Why can't I do this? And I think that's where, like, going back to my previous point about policy and ethics and really trying to put bumpers around the information so that there is less misinformation and disinformation out there in that ecosystem. We can't prevent all of it, but I do think it'll lead for a more fruitful and in-depth conversation between the patient and the provider, rather than one of these, like, I'm just telling you to go do this or take this med, right? It'll be more of a conversation. And I think that's a good thing. I think that empathy and sympathy that will go with diagnoses will be even more important.
Yeah, if I give you one perspective, that perhaps the use of artificial intelligence in medical education is going to kind of change the way it is taught, from a didactic lecture format to a more interactive learning, a more reasoning-based learning, a more practical approach-based learning using VR, AI tools. And I think that is something that's going to get translocated. I mean, that's going to kind of translate into the real world practice when students pass out from their medical school. So that thought process would probably kind of come out. So I really see a lot of evolution happening in the next generation doctors. I mean,
Absolutely.
I can hardly imagine a doctor not using technology in the next 5 or 10 years, especially the ones who are coming out of medical school now. And I really feel that their way of approach to a patient, to a case, would be somewhat a little different than the conventional approaches that has been taught to us. And I think AI will play a very strong role in that particular segment. But again, yes, you said that point very right, that artificial intelligence is not going to take away jobs, but it's going to create more jobs.
Absolutely.
So that is.
And I think my role as a professor at Pitt, and as a PA, one of my goals is to teach AI as early as possible to healthcare providers and really inject it into their curricula as much as possible and use it Right now, I think we're at the stage where there are faculty who don't know how to fully use it, and so there's a fear factor around it. And students don't know whether they should be using it because are they cheating, are they not cheating, right?
Yes.
And so I think we're in the midst of kind of that tussle, so to speak. And while that kind of, once it settles down, and I think we have enough faculty and clinicians who are educated in this space, I think that will eventually lead to that shift in, to your point, that the students are going to have to learn this. And I will say, even perhaps learn AI as a specialty, right? Like we have many physicians here,
Yes.
and who get their MBA right after med school or right before med school or whatever, or PA school. I think learning AI and perhaps getting a second degree or a minor in computer engineering specific to AI and machine learning might be the new thing that we see.
Key factor is having the ethics and the policies, and then also having guided use of AI. That is also very important, especially amongst the students. I wouldn't call it restricted, but I would rather say the guided use of artificial intelligence. So you're absolutely right. Those guidelines need to be set, and all this will lead to wiser use of artificial intelligence. I mean, technology is a boon, at the same time it can also be a curse, but that doesn't let technology, I mean, it doesn't stop technology from growing, and it doesn't stop us from using it. So I mean, I guess the same is going to be there with artificial intelligence, and we just have to keep on leveraging it, learning with it, learning from it, and just perhaps making ourselves smarter using it, if I can put it that way.
Right, make ourselves quote unquote smarter.
Yes.
Right. We're gonna have to. I mean, there's no way around it. So, yeah.
I mean, there are people who calls artificial intelligence as augmented intelligence. Well, two different terms, but well, somewhat we can kind of find it synonymous, or maybe not. That's a debate. But yeah, it's definitely going to make us smarter than what we are, because it's going to kind of make our job much easier, take us forward. But we need to use it ethically, responsibly. That is, again, a very important term. We need to use it responsibly and, of course, with guidance. So I think we had a fantastic discussion today, Dipu. I mean, we kind of looked at the past, we kind of explored the present, and we kind of created a vision of how we see AI in our ecosystem in the next 5 years. Can we have Harshita back? Because I'm sure after this exciting discussion, we'll be having some fantastic questions coming up from our patient listeners. So Harshita, do we have any questions from our audience? Because this is a live podcast. Harshita, do we have any questions?
Yeah, so there's one question. What are the most promising areas where AI can make a tremendous impact in the post-COVID era?
Okay, Deepu, I would like to take you that question. Go ahead.
Sure. So one of them is telemedicine, which I think has taken off. What that is just, I think, like across the board. The second one is, I think, wearables, and then the amplification of the use of the EHRs. Because I think prior to COVID, we were not using EHRs as well as we should. We probably, most practitioners who have EHRs here probably use about 10% of its capacity. And I think in the post-COVID era, because of generative AI, a lot of the EHR companies are now really starting to use algorithms and predictive analytics in the background to make informed decisions on patients. And this is it's going to drive a lot of clinical decisions. The second, so that's from a healthcare provider perspective. From a patient perspective, it's wearables. I think more and more people have wearables, or they have tools that are connected to their providers' offices, or will in the very near future. I can say here in the US, most people had thermometers in their homes before the pandemic. I could say now most people also have pulse oximetry detectors in their homes post-COVID, right? And so that's like the first step, I think, in the connectivity that's going to happen in terms of wearables and smartwatches and all sorts of other things, rings that are being developed. And I think so. I read somewhere there was a necklace that was also being developed to monitor various things. So I think lots of wearables and lots of new things. And I also see the use of digital tattoos becoming very mainstream in the near future. Those are still in the various early stages, but the tattoos that we've seen are using biometric inks to actually create tattoos on the skin, kind of like henna tattoos.
Yes.
They measure various electrolytes on your skin through the sweat. So in terms of, you can imagine an athlete wanting this information as they're training to maximize their training protocols. So just some things to kind of think about in terms of it. I think these are the areas we're going to see the biggest movement.
I'm gonna add one more perspective to this question, and I thank the audience for asking this question. This is a very important question. I think COVID swept all of us away. I mean, none of the countries were prepared for a pandemic of this resort. Artificial intelligence is going to help us prepare for a pandemic in a much better way, because predictability is going to come. We're going to be able to understand and decipher a disease much quicker. I mean, we did decipher COVID quite quick. I mean, research was fantastic across the world. I mean, the production of the vaccines were fantastic across the world, both in the western and the eastern part of the world. Drug trials will improve, and it will remarkably, it's going to kind of accelerate. So I think that's going to be a very important thing. If you are looking at another set of a pandemic coming in, I mean, we don't want that to happen ever. But I think with the use of artificial intelligence, we would certainly be, humanity or mankind will definitely certainly be much better prepared than what we were in the COVID era. So I think that's going to be a huge thing using artificial intelligence. So that's one perspective I would like to add to that. Any more questions, Harshita?
Yeah, there's one more question. So how do you get a second opinion in using AI, similar to consultants having different opinions in complex clinical scenarios? Can AI give prognosis or decide between various treatment options?
So I'll just give a quick survey result of this particular question. This is a survey we did with about 1,000 doctors in our country, and we asked this question to them that, if AI differs, if the AI predictability differs from your clinical decision, what would you go for? Would you go with your clinical decision? Would you sort of go with what the AI tells you? Or would you refer the patient to your colleague or peer group for a second opinion? Trust me, we had a very mixed response. Now, the majority of the doctors said that we will go with my clinical opinion. And I think that's fair, right? I mean, you believe yourself, unless you believe it in yourself, I mean, it's not going to happen. So you need to keep your grounds strong, and you're going to say that, yes, my clinical wisdom is something that I'm going to go with. But believe me, a larger section of the doctor community also said that I would rather take a second opinion from my friend than going point blank with my opinion. So you know what this kind of tells us? That with AI predictability is coming in, it's going to have a change in the way we think and in the way we comprehend things. So, I mean, this is just a survey result I'm sharing with you. So AI can be a fantastic tool to kind of tell you what you have missed. And it might just be a great way of looking at the differentials. I mean, I think we are already exploring some of the AI tools, which gives you fantastic differentials and provisional diagnosis once you give the clinical history, and that algorithm is still learning. And I mean, I'm happy to be kind of exploring it. And there are many such algorithms being built across the world, as I know of. I think Dipu would also be knowing about such algorithms, and we're exploring them. The end of the day, the decision is always going to be with the clinician. But yes, it's going to make you think, that is for sure. It's going to make your errors go less. That is definitely for sure. It's going to increase your confidence into the decision that you're giving. That is also for sure. These are my thoughts. I would love to hear Deepu's inputs on it.
I completely agree. And I think those survey results are very interesting. And to me, I think to our earlier point is that it will make collaboration much more the norm, I think, in terms of, I mean, we're in healthcare generally, we are very collaborative, but I think this getting a second opinion from a colleague is going to be becoming the norm in many instances. I'm not sure, as you said, the AI models are still very much in the learning phases. I'm not sure I would purely leave my clinical decisions to an AI model quite yet, but at least it will help me critically think about something I might have missed, right? If you put in the information and it gives you a differential and you look at the 10 things and then 2 of the things that were things that you had not thought of, maybe you'll chase those down, or you'll ask those extra questions that you need to ask on a history, or do a physical exam part that you hadn't thought of doing in the past. And so I think it will make our critical thinking skills a lot better, and our collaborative processes a lot more tight-knit.
Yes, and I think that brings to that point of responsible AI. You have to use artificial intelligence in a very responsible way. I mean, if you stop doing mental mathematics and just keep using a calculator, you're going to forget mental mathematics. So it's just like that. I mean, you got to kind of keep your skills going. Otherwise, it will end up de-skilling you. So that's where we have to use artificial intelligence in a very responsible way. That's a very good question coming in from the audience. One more we can take, Harshita, and then we can call it a wrap. And if there's no more, then we can call it a wrap. It's up to you.
Yeah, we'll end the session.
Thank you. So I think that was a fantastic and a riveting discussion we had, Dipu. Thank you for joining us. Thank you, Harshita, for for putting us with the questions and kind of hosting us. And one last take-home message from you, Dipu, before we end.
So I'm going to reiterate what I said before: be adaptable, be curious. That's basically what you need to do to be successful in this space. I think there's a lot of learning to do out there, and every day something new is happening.
Absolutely. So thank you, dear viewers, for joining us today. And before I hand it over back to Harshita, we're going to come back to you in another fortnight with another very interesting guest. And we're going to kind of keep exploring the use of various artificial intelligence models, the algorithms, and the various applications in the field of healthcare and medicine. So do join us in the next episode, and we promise to make some interesting discussions there as well. So over back to Harshita.
Yeah, thank you. Thank you, Dr. Amit and Dr. Dipu. We extend our sincere thanks for sharing your insights on this very essential topic. And thank you to our audience for tuning in. And before we conclude, I urge you to explore MedSynapse platform, our vibrant hub that's redefining the healthcare landscape. I'll see you soon again. Bye-bye.